Hi guys, welcome back to my channel. It's Toya from All About Nursing. Today we'll be talking about insulin administration and how we can give medication, how we administer insulin accurately for our patients. So we have been doing drug dosage calculation, and insulin administration is also part of that, okay? We tend to make a lot of mistakes with our insulin administration. I think it's sometimes we don't know how to read our sliding scales and understand orders. So let's talk about this today, all right? So we have a sliding scale here. So our sliding scale says our blood sugar of 150 to 200, I give 2 units. 201 to 250, I give 4 units. 251 to 300, I give 6 units. 301 to 350, I give 8 units of insulin. 350 and above, I give 10 units and contact the provider. So that's our insulin sliding scale that we'll be using for some of our examples today. So let's talk about our first scenario. If a patient's blood sugar glucose is 275, so our patient's blood glucose is 275. Our patient's is 275. I keep writing 250. What is wrong with me? 275 mg per deciliter. How much insulin am I supposed to give this patient? Okay, let's go to our sliding scale. So our patient is 275. Let's look. Is the patient 150 to 200? No. Is my patient 201 to 250? No. Is my patient between 251 to 300 milligram per deciliter? Yes, because 275. So my patient is going to be getting 6 units of insulin. Yeah? Because our patient's blood sugar was 275. You don't give what you think you have to give. You give what you see as your order. Okay? Next one. Using the same sliding scale behind me, our patient has a blood sugar of 345. What is our instructions? Okay. So the patient blood sugar is 345. How much insulin do we give this patient? Let's look. Is the patient 150 to 200? No. Is the patient 201 to 250? No. Is the patient 251 to 300? No. Is our patient 301 to 350? Yes, because the patient is 345. So we have to give this patient 8 units of insulin. All right. So remember, when you are reading your blood sugar instructions and orders, pay attention, because you do not want to be making errors. You do not want to give more than you are supposed to, and you do not want to undergive the patient the insulin as ordered. You have to give the amount of insulin the doctor ordered for the patient. Our third scenario, using the same sliding scale, how much insulin should be administered if our patient's blood sugar or blood glucose level is 360? This patient's blood sugar is very high. So my patient's blood sugar is 360 milligrams per deciliter. How much insulin, based on this sliding scale, I am supposed to administer to my patient? So 150 to 200? No. 201 to 250? No. 251 to 300? No. 301 to 350? No. 350 and above? Yes. So my patient is 360. So I have to give this patient 10 units and, CD plus, contact the provider. Do not just follow part of the order. Follow the entire order. The order says contact the provider, but you are given the 10 units. So you give the 10 units, then you call the provider or the doctor, wherever, because in different places in the world, people practice different, okay? Some places have licensed provider because we have nurse practitioners, we have physician assistants, we have the residents, which are the doctors, so licensed provider. So this is the order that we follow when we are giving using a sliding scale. When we are using a sliding scale, the instructions is very clear. You make sure that you understand. If you do not understand the sliding scale, you contact someone, one of your colleagues, and ask them to interpret it with you, please. You need to practice safe nursing. And remember, follow all the steps of the sliding scale. Don't assume you can memorize it and remember at all times. Doctors order different sliding scales for different patients sometimes. Not all the time. I have seen doctors modify sliding scales that some patients, if their blood sugar is 140 and above, they start getting insulin. And then we have some patients, unless they reach 151, they get insulin. So nurses, nursing students, let's remember to practice safe nursing care. And remember to look out for more videos. Look out again for next episode. Let's do this. Nurses do it better.